Fluid on the lungs, known medically as pulmonary edema, and sepsis are two serious conditions that can be life-threatening if not treated promptly. Pulmonary edema occurs when excess fluid accumulates in the lungs' air sacs, making it difficult to breathe, often presenting with symptoms like shortness of breath, a feeling of suffocating, and a frothy cough. Sepsis, on the other hand, is the body's extreme response to an infection, leading to systemic inflammation which can rapidly progress to organ dysfunction and shock, indicated by fever, increased heart rate, confusion, and severe discomfort. Treatment for these conditions varies. Pulmonary edema may require oxygen therapy and medications to reduce fluid and pressure in the lungs, while sepsis necessitates urgent administration of antibiotics and supportive care to maintain blood pressure and organ function. Risk factors for both conditions include a history of heart or lung diseases, compromised immune systems, and exposure to certain infections or toxins. Here are detailed aspects of each disease, including their causes, progression, and the latest in management and prevention strategies. Onset of symptoms: acute versus insidious. In the context of fluid on the lungs and sepsis, the onset of symptoms plays a critical role in differential diagnosis. Acute onset, where patients rapidly develop breathing difficulties, chest pain, or cough, often indicates a sudden and possibly life-threatening event like cardiac failure or acute respiratory distress syndrome, leading to pulmonary edema. In contrast, an insidious onset with slowly worsening fatigue, shortness of breath, or subtle changes in mental status might suggest a gradually progressing infection or inflammatory condition, potentially culminating in sepsis if not treated. Identifying the pace at which symptoms evolve is crucial for clinicians to pinpoint the underlying cause, whether it's a direct issue within the lungs or a systemic infection affecting multiple organs, including the respiratory system. Prompt and accurate differentiation can significantly impact the urgency and type of treatment required to address these conditions effectively. Primary involvement: pulmonary versus systemic. Fluid on the lungs or pulmonary edema typically manifests as breathlessness and crackling sounds during breathing, signaling a primary pulmonary issue. It's caused by fluid accumulation in alveoli, impairing gas exchange. Contrastingly, sepsis is a life-threatening systemic reaction to infection, leading to widespread inflammation and organ dysfunction. Symptoms are broader, like fever, rapid heart rate, and confusion, reflecting its systemic nature. Early recognition is crucial as the treatment varies: diuretics and oxygen for pulmonary edema, and antibiotics with supportive care for sepsis. Misdiagnosis can prove fatal, as both conditions can deteriorate rapidly without appropriate intervention. Typical causes: cardiogenic or non-cardiogenic versus infectious agents. Fluid on the lungs, medically known as pulmonary edema, often arises from cardiogenic causes, such as heart failure, where the heart is unable to pump effectively, leading to fluid backup in the lungs. Non-cardiogenic causes may include acute respiratory distress syndrome, ARDS, kidney failure, or high-altitude exposure. In contrast, sepsis is a life-threatening response to an infection which can progress to septic shock. Microbial agents such as bacteria, viruses, or fungi commonly trigger it. While both conditions can coexist, especially since sepsis can cause fluid accumulation in the lungs, their primary instigators fundamentally differ. One is primarily a result of hemodynamic factors, and the other is related to an immune response to infection. Accurate diagnosis is critical for effective treatment. Diuretics and heart support for cardiogenic pulmonary edema versus antibiotics and infection control for sepsis. Primary symptoms: respiratory distress versus generalized inflammation. When a patient presents with respiratory distress, fluid on the lungs, known medically as pulmonary edema, may be suspected. Symptoms can include difficulty breathing, a feeling of suffocation, wheezing, and coughing up frothy sputum. It's frequently associated with heart problems but can also be due to infections, certain medications, or trauma. On the flip side, sepsis is the body's extreme response to an infection, which can result in widespread inflammation and organ failure. Symptoms are often systemic and may include fever, increased heart rate, confusion, and extreme discomfort. While both conditions can initially present with similar respiratory symptoms, sepsis would include broader systemic signs, thereby altering the treatment strategy and urgency. Understanding whether respiratory distress is a localized issue in the lungs or part of a systemic inflammatory response is crucial for accurate diagnosis and effective management. Treatment focus: respiratory support versus antimicrobial therapy and hemodynamic support. When treating fluid on the lungs versus sepsis, the approach must be tailored to the underlying cause. In the case of fluid accumulation, such as pulmonary edema, respiratory support is crucial. This may include oxygen therapy or mechanical ventilation to ensure adequate gas exchange. Diuretics can also be administered to remove excess fluid. Conversely, sepsis requires prompt antimicrobial therapy to combat the infecting organisms. Additionally, hemodynamic support is often necessary to counteract septic shock and maintain blood pressure and organ perfusion. This can include the use of intravenous fluids, vasopressors, and inotropic agents. While both conditions are critical, the prioritization of treatment modalities differs fundamentally to address the root cause and mitigate the primary threat to the patient's health.